Have you ever wondered if your low thyroid function could be contributing towards abnormal readings on your glucose monitor? If you're utilizing something like a continuous glucose monitor, CGM, or even just pricking your finger with a glucometer to test your blood glucose levels, in today's video, I'm going to walk you through exactly how to understand the differences between these different types of glucose readings, how your thyroid function is impacting your readings, and some steps that you can start to take to actually improve your glucose control. We're going to get into how thyroid function impacts your glucose control in today's video. If you've ever used a continuous glucose monitor, you might notice that there's a difference between your reading on your CGM or continuous glucose monitor and your blood glucose testing measure like a glucometer, or even through a lab testing option like getting a fasting blood glucose or A1C test. And there is a key reason for this. When you're utilizing a continuous glucose monitor, it's actually testing through your interstitial fluid, not your serum, which is where we would be testing through with a glucometer or with a blood draw. So there is some delay in reading, and typically you're going to see that a CGM is going to read a little bit lower in glucose than would getting the blood drawn or doing a glucometer prick at the exact same point in time. They're both accurate methods. We just want to make sure that we're looking at apples to apples and that we're not comparing your data from a CGM over to a glucometer within the exact same day or reading. So it's important that yes, you calibrated your CGM, but that we're also more so looking at trends in data and looking at what we call glucose excursions rather than just the raw data. So what I mean by that is we want to see how your glucose changes are happening from different types of events, such as how is exercise impacting glucose control? How is what you eat impacting glucose control? Are you getting a really large excursion from before the meal to postprandial, which is about an hour to 2 hours after eating? And how are other types of lifestyle habits, maybe things like sauna or ice bath or taking a hot shower, impacting your glucose control? That's really where we can pick up on some insights to really personalize and individualize your diet even further to be able to improve your overall metabolic health. Now, let's get into how the thyroid impacts this raw data as well as those glucose excursions. The first way that the thyroid impacts your glucose control is through hepatic glucose output. Hepatic is just a fancy word that means liver, and our liver is a central place where glucose control is regulated, and that's because our liver is one of our largest storage places of glucose or glycogen. When there is low levels of free T3, active thyroid hormone, this actually can impact our liver's control of glucose output. Too little T3 or active thyroid hormone, and the liver can become sluggish or dysregulated. Whereas if we have too much T3, this can actually cause the liver to overproduce glucose, thereby raising the numbers that you're going to see on your CGM or on your raw glucose data. Another way the thyroid impacts glucose control is through the hormone insulin. Insulin is a hormone that is released from our pancreas in response to glucose excursions. The role of insulin is to make sure that we're able to get that glucose out of the bloodstream and bring it into the cells and some tissues that are dependent off of glucose, such as our liver and muscle cells and our brain cells. When there's not enough T3, there isn't enough insulin to be able to do its job. T3 actually improves insulin sensitivity, so we may still be producing a lot of this hormone, but it's not actually sensitized and working effectively. And so what happens is that more of that glucose actually stays in the bloodstream and not enough of it is getting pulled out of the bloodstream into the cells and tissues that need it. So in hypothyroid states where there's low thyroid function, the cells actually become less responsive to insulin, and we actually see a correlation with a greater risk of insulin resistance occurring. T3, or that active thyroid hormone, also controls what's called GLUT4 expression. GLUT4 is a glucose transporter that's responsible for helping transport that glucose into those tissues and cells that need it. This is especially important during exercise, as during exercise, these glucose transporters are responsible for really pulling in any intracarbohydrate. So this is especially important if you are maybe an endurance athlete and you are utilizing carbohydrate during exercise. If you have low thyroid function, this actual process can be impacted, and you may notice that there's more abdominal slushing and more difficulties with utilizing intracarbohydrate because of the downregulation that happens in this GLUT4 transporter. So when there's not enough of this free T3 or free thyroid hormone, GLUT4 is decreased, and we don't have the ability to pull that glucose out into those cells and tissues. So without enough GLUT4, more glucose hangs out in the bloodstream or within our interstitial fluid, and you're going to see a more pronounced level of glucose as your baseline. Whereas we also are going to see more glucose excursions happening because added to that, we also have this issue of insulin resistance that's happening where when we eat, that hormone insulin isn't helping us out as much to be able to help pull down that postprandial glucose response. So ultimately, we're going to see thyroid function impact not just your resting blood glucose level, your fasting level, or your average throughout the day, but also those glucose excursions from particular lifestyle habits or even eating particular amounts of carbohydrates. Another layer here is stress hormones like cortisol. Cortisol is a glucocorticoid hormone, which means that when cortisol is released, our body actually releases glucose because it's thinking that we need to mobilize energy for whatever the stressor is that our body is going in to defend us from. When most individuals have hypothyroidism, there's typically some type of adrenal involvement, and we see a lot of adrenal dysregulation happening when there's low thyroid function. All of our endocrine system works together like a symphony, so it's really common that when we see one hormone imbalance, we're going to see others happen at the same time. We also see this happen in individuals with Hashimoto's that don't have low thyroid function. Typically with Hashimoto's, though, we're going to see more issues with low cortisol, which is what we would consider stage 2 adrenal fatigue, where you are no longer overproducing cortisol, but the body is in a situation where we've burned out our resources to keep making more of those stress hormones, and now that cortisol reading is more flatlined. But ultimately, both situations can impact glucose readings because of this glucocorticoid function and our body's ability to actually control the stress hormone response. So ultimately, with low free T3 or low thyroid function, we are going to see a slowed hepatic glucose clearance. We're going to see more of those postprandial responses happening. So if you were to eat something that someone that didn't have low thyroid function has, you're probably going to notice that there is a greater excursion that occurs even from healthy food sources. You might notice that something like a sweet potato could spike you 60 milligrams per deciliter. That is a very normal response that I see in a lot of patients that we work with. An elevated A1C can also be compounded by other variables such as your fatty acid intake and your red blood cell turnover. So individuals that are anemic as well, which is very common to go hand in hand with low thyroid function, as well as individuals that are utilizing a lot of fatty acids like omega-3 fatty acids, may notice a higher A1C. Anemia is something that we do want to correct because we do know that the role of iron is important for regulating thyroid hormone function, and individuals that have iron deficiency are at a greater risk of hypothyroidism. Of course, making sure that we have adequate omega-3 fatty acids, though, is very beneficial for us. And so if we're seeing an elevation in A1C occur simply because you've added in more omega-3 fatty acids, it's not something as concerning, and that may be where we look to utilizing a CGM to be able to really pick up on more of this data and what's happening within these excursions. The reason that this happens is because your cells become a little bit more fluid, it can become a little bit more buoyant, and when this happens, that naturally inflates A1C because A1C is just a measure of glycation of hemoglobin. And so red blood cell life is impacted as a response. So if you're utilizing a CGM and you've noticed these trends happening, and you also have noticed that on your labs or maybe even through diagnosis that you have low thyroid function, here's a couple things that we look at within our patients. The first one is the data to understand where there might be more sensitivities and where we're able to pull levers to be able to help improve glucose tolerance. There are some supplemental things you can do as well as dietary changes that you can make. One of those being to really focus on how you're pairing foods together and making sure that the carbohydrates you are eating are really fiber rich to tolerance. Of course, if there's digestive issues at play, there may be a little bit of a push and a pull to improve your digestive issues so that we can improve the amount of fibers in your diet. The second thing is improving muscle, because muscle is like a sponge to glucose. Muscle is responsible for about 80% of our glucose uptake. So when we have low thyroid function and that glucose uptake is inhibited, then we can actually help with that process by by building more muscle and even just engaging in exercise, because exercise improves this process by improving glucose uptake as well as insulin sensitivity, both things that are impacted with low thyroid function. In addition to that is improving the thyroid function. That would ultimately be the most powerful for improving your glucose control because of the role that your thyroid has on glucose metabolism. And so looking at addressing the root causes of what's driving the low free T3 levels, or what's driving the Hashimoto's and the immune system to attack and destroy the thyroid cells, is going to be a really important piece of your treatment plan. And that's where we utilize root cause advanced testing so that we can identify those root causes and have a really clear path forward in terms of how to structure and implement different phases of your healing plan to be able to help you start to see improvements happen within your thyroid function with time. So those things are all happening in the background. We might utilize CGM testing from time to time to see how things are improving as we're starting to see improvements happen within thyroid function or within other symptoms that indicate that thyroid function is improving. Maybe we also are noticing that down the road, hair growth is improving, nail growth is improving, your skin isn't as dry, you're not as bloated. These are all signs and symptoms that thyroid function is improving and might be a reason for us to re-explore utilizing a CGM for a 10-day trial period so that we could see how there may be some improvements happening within glucose control. Ultimately, I'm always about providing you the most food freedom. Of course, we want to make sure that most of those foods are coming from really nourishing, healthy, nutrient-dense foods, but I want to make sure that anyone we're working with has the ability to go on vacation or have a birthday meal and not feel like they're going to end up in a flare afterwards because of what they ate. And so that's what improving your health, improving your thyroid function is really going to help you be able to do, is help you have more freedom to not only get your health back and not be so symptomatic, but also to give you more flexibility and more room for error within having a perfect diet or perfect lifestyle routine. If you're unsure of where to start to improve your thyroid function, I have a free download guide for you that walks you through my top thyroid functional foods. It's going to walk you through some of these top food sources that you can start to incorporate to be able to help improve your thyroid function. Then if you're ready for the next step, that's where our one-on-one program is really going to help you take a deep dive into the root causes that are driving the glucose abnormalities. And that's also where we're going to walk you through utilizing some CGMs from time to time, if it's a good fit for you, to be able to understand how food is affecting your glucose and how improving your thyroid function is improving your glucose metabolism over time. You can find the links to both below. Please hit the bell to subscribe to my channel so you'll be the first to know when I release a new video.